Chapter 12, Eye. In the next section, we're going to define, pronounce, and spell surgical terms and diagnostic terms. We're also going to do complementary terms and look at abbreviation meanings and look at clinical language and application of the terminology. Surgical terms from word parts include blepharoplasty. Plasty is surgical repair, and blepharo refers to the eyelid, so this is surgical repair of the eyelid. Cryoretinopexy. Pexy is surgical fixation. Cryo is cold, and retino is retina, so this is surgical fixation of the retina by the use of extreme cold. Dacryocysto-rhinostomy. Ostomy is creation of an artificial opening. Dacryo refers to the tear or the lacrimal sac, and of course, rhino refers to nose. So this is creation of an artificial opening between the tear sac and the nose, and this is when there's a blockage of the lacrimal duct, and they use this procedure to restore the drainage from basically the eye into the nose. Sclerotomy. Otomy is incision into, and sclero is sclera, so this is incision into the sclera. Some examples of surgical terms not built from word parts include LASIK, which is a very common abbreviation, a very common procedure. It stands for laser assisted in situ keratomileusis, and this is a laser procedure used to reshape the cornea of the eye and correct very common vision problems such as astigmatism, hyperopia, and myopia. Phacoemulsification, or phaco, this is a method that is used to correct cataracts, where an ultrasonic needle is placed into the capsule and it breaks up the lenses, and then the lens pieces are aspirated out. Very common, again, procedure in the area of the eye. Scleral buckling is a procedure to repair retinal detachment. In this case, they take a piece of silicone and applies it to the abnormal part of the eye, and as it buckles, then it then helps to decrease the traction on the retina and helps to restore and to fix the problem. Trabeculectomy is a surgical creation of an opening that allows the aqueous humor to drain out of the eye under the conjunctiva where it's absorbed. Treats glaucoma, helps to reduce that intraocular pressure in the eye. Vitrectomy, this is a surgical removal of all or part of the vitreous humor. And it's used in treating diabetic retinopathy or retinal detachments, or if there's a hole in the macula itself. Diagnostic terms that are built or not built from word parts. The fluorescein angiography. This is radiographic imaging of the blood vessels of the eye, and this would be one of the terms that is actually built from word parts. Ophthalmoscope. We know a scope is an instrument that's used for visual examination, and ophthalmo tells it's examining the eye, so this is instrument used for visual examination of the eye. Optical coherence tomography. In this case, it is a test that uses light waves to create cross-sectional images of the retina, and these are used in helping to examine for such disorders as macular degeneration or retinopathy or glaucoma, or even a problem with the optic nerve. Slit lamp is a horizontal binocular microscope. You see it very commonly in most optometry and ophthalmology offices. It shines a very narrow beam of light and allows looking at the eye in more defined detail. And we see that in looking at the conjunctiva, the cornea, the lenses, and the vitreous humor, and a very common device used in eye offices. Tonometer is a instrument used to measure. In this case, it's measuring pressure in the eye, and we see this very commonly when they're looking for the intraocular pressure in situations of glaucoma. Complementary terms from word part examples include nos chorea, which is condition of is IA. AN refers to the absence of, and IOSO is equal pupil, so this is a condition of absence of equal pupil. Intraocular, AR, means that it is pertaining to. Intra is within, and oculo is eye, so this is pertaining to within the eye. Nasolacriminal, AL is pertaining to again, nasal is nose, and lacrimino is referring to the tear ducts in most cases. So this is pertaining to the nose and the tear ducts. Ophthalmology, ology is the study of, ophthalmo is the eye, so this is the study of the eye, or ophtho is going to be the abbreviation here. Pseudophakia. Phakia refers to the lens. Pseudo is false. So this is IA is condition. So this is condition of false lens. Examples of complementary terms that are not built from word parts are emmetropia. This is a normal refractive condition of the eye. Miotic is an agent that constricts the pupil. In this case, it's a medication like an eye drop. Mydriatic is an agent that dilates the pupil. And this again is a medication and typically an eye drop in this case. Optometrist is a healthcare professional who diagnoses, treats, and manages diseases and disorders of the eye and visual acuity of the eye. They are referred to as an OD or a doctor of optometry. Visual acuity, VA, common abbreviation, is referring to the sharpness of vision for either distance vision or near vision. So abbreviations are AMD, which means age-related macular degeneration, FA, which is fluorescein angiography, OCT, which stands for optical coherence tomography, phaco, which, as we looked at earlier, is phacoemulsification, and VA is visual acuity. We'll look at some clinical information with the use of the terminology. I would again encourage you to read this along with me, and especially the bolded terms. Better if you can say them out loud, because that's going to use all of your structures of speech then. An elderly gentleman visited his ophthalmologist because of decreased vision. A tonometry examination showed borderline readings. Visual acuity measurement indicated a mild degree of myopia and presbyopia. A diagnosis of glaucoma is suspected in this case, and timolol eye drops were prescribed 1 drop daily. Cataract of the right eye was found. Lens implant surgery, which places an intraocular lens, will be performed when the cataract matures sufficiently. Approximately 5 years ago, the patient had a detached retina on the left eye. A scleral buckling procedure was performed and was successful in halting the progression of the retinal detachment.